orthopedic and orthodontic treatment of patients with cleft lip, palate, importance of prevention.
En la casuística de nuestros servicios de fisurados del Hospital Regional de la región, hemos detectado
In case study in our services for cleft lip and palate patients at our regional hospital, we have identified that 81% of patients have cleft lip or palate, 57% unilateral, and 24% bilateral. The rest of cleft lip palate patients have simple cleft lip, syndromic cleft lip, dangling cleft lip, incomplete cleft palate, and submucous cleft palate, all of them in a lesser percentage than bilateral cleft lip and complex unilateral cleft lip.
Bilateral y unilateral complicado. En el caso de pacientes
In the case of patients with complex cleft lip, we know that the lip, alveolar ridge, and the palate are involved. This type may be unilateral and bilateral, as we know.
y bilateral. Respecto al tratamiento ortopédico,
In regard to the orthopedic and orthodontic treatments of these conditions, we have created a spoke wheel in which each spoke represents each of the specialties that are involved in the integral treatment, such as surgery, orthodontics, orthopedics, prosthesis, hearing and speech therapy, psychology, pediatrics, etc. That is, the treatment should be multidisciplinary and interdisciplinary.
interdisciplinario.
Orthopedic and orthodontic treatment of complex cleft lip faces. I'd like to explain the determining factors of the complexity of the orthodontic treatment of a child with complex unilateral or bilateral cleft lip. What are the determining factors? To guide the process of development and growth of the face and the masticatory system from the child's birth to adolescence. Second, collapsing action of scar tissue. Absence of bone tissue in cleft lips. Developmental defect of teeth, introsius, retention of teeth, ectopic eruption of teeth. Also, parents' socio-economic and cultural conditions are a significant factor.
Factor de relevancia.
Well, apart from these orthopedic and orthodontic phases, there are also other phases involved related to the integral treatment of a child with cleft lip. A pre-surgical phase, a temporary teeth phase, a mixed dentition phase, a permanent teeth phase, orthopedic treatment, orthodontic treatment, prosthetic rehabilitation, and orthodontic surgery. How old should a child with unilateral and bilateral cleft lip be to start with our treatments?
Total. Dentro del primer mes,
75% of the children start them before they are 1 month old. From 1 to 6 months, this percentage increases 20%. That is, about 95% of these patients start their orthopedic treatment within their first 6 months.
del 95%. Iniciamos nuestro tratamiento.
We start our pre-surgery orthopedic treatment by installing elastic bands that pull soft tissues of the face so that the lip segments get closer.
Los tejidos blandos de la cara para que se aproximen.
This will facilitate calloplastly. However, we will also perform an orthopedic intraoral treatment of hard tissues of the jaw.
Vamos a realizar una ortopedia intraoral de los tejidos duros del maxilar. Acá podemos ver
Here you can clearly see the movement we have made with the intraoral devices of the higher segment reaching the lower segment.
contactando con el segmento menor. Ustedes podrán ver
You can see that among other advantages, the cleft lip has been reduced significantly. This makes us think that we facilitated the palatoplasty to be performed
se
soon.
va a hacer próximo mes. Pero también
But we perform this pre-surgery intraoral orthopedic treatment in patients with bilateral cleft lip and palate.
de labio leporino y fisura palatina bilateral. Acá tenemos un paciente antes de iniciar la ortopedia prequirúrgica
This is a patient before starting the pre-surgical orthopedic treatment and after that. You can see that a very significant reconstruction of the premaxilla has been made. Also, the cleft palate has been reduced some millimeters. This, of course, facilitates the palatoplasty.
Ahora bien, en aquellos casos en que tenemos una premaxila prominente junto.
Well, in patients with protruding premaxilla and a compression arcs, in order to retract the premaxilla, we should widen the arcs. By widening the arcs, we can retract the premaxilla and first perform the cheiloplasty. As you can see in this case, the distance between the prolip and the lip is about 2 or 3 centimeters. In these cases, we install the intraoral device to expand the arcs.
En estos casos, como decía, instalamos el dispositivo intraoral para expandir los arcos. Acá pueden ver ustedes el dispositivo.
Here you can see the device that we use to expand them more or less. In this way, we create spaces to retract the premaxilla.
En esta forma, como pueden ver ustedes, se realiza la
As you can see, the cheiloplasty is performed in optimal conditions with respect to the previous orthopedic treatment.
No obstante, nosotros tenemos que considerar.
However, we have to consider that this patient is growing, therefore his tissues and organs are changing.
Tejidos y sus órganos se van modificando. Aquí tenemos un niño de.
Here we have a 4 or 5-year-old child where his premaxilla is quite retracted. The middle third of his face tends to be underdeveloped.
Del tercio medio de la cara. En esta etapa procedemos.
In this phase, we make a pre-surgery orthopedic treatment in the jaw. The temporary teeth are arranged in the best way.
Dentición temporal. Nos encontramos en un periodo más avanzado. A los 7 u 8 años.
This is a more advanced period when the child is 7 or 4 years old, when his permanent teeth have invaded the segments.
Y con ello se ha producido un tremendo desplazamiento.
There has been a significant movement in central and lateral incisors. The child has had a significant retraction of the middle third of his face.
Una franca retrusión del tercio medio de la cara. En este esquema podemos ver nosotros que ya en la dentición temporal los incisivos, ¿no?
In this diagram, we can see that in the temporary teeth, the incisors tend to slightly burst, moving to the palate. Then, permanent incisors continue moving, as we can see in this diagram.
Como podemos ver en el gráfico. También, entre otros problemas.
Also, among the other problems, we find retained teeth, especially the canine tooth. We'll move the canine tooth later to the horizontal plane. This is so important for the rehabilitation of the bite.
Tan importante para la rehabilitación de la oclusión. Acá podemos ver nosotros el típico caso del paciente cuyo.
Here you can see the typical case of the patient whose jaw was exposed to the collapsing action of the scar tissue. You can see the compression of the arcs. Thus, if we start the orthodontic treatment in this child who is 11 or 12 years old, the problem will be very complex because this child also has graft, so the expansion of the arcs will not be possible at all.
Las expansiones de los arcos van a ser totalmente imposibles. Llegamos con nuestro paciente portador de labio leporino o fisura palatina, complicado y.
This is our patient with complex cleft lip or palate. You can see that at the age of 18 or 20, the patient has an actual rejection of the middle third of their face. If you don't make the appropriate support, the problem will continue.
Problema continúa. Aquí podemos ver en esta niña en que este rechazo del tercio medio.
Here you can see this girl with a rejection of the middle third of her face. In fact, she shows after effects. She has anatomic, functional, aesthetics effects, and psychological problems. And she has a serious depression.
De una severa depresión. Acá podemos ver la paciente.
Here you can see a patient with apparent effects.
Las secuelas se notan en forma manifiesta. Aquí podemos ver la relación de los arcos.
Here you can see the relation between the arcs in which the middle third of the face, the high arc is about 2 centimeters from the lower arc. This shows the level of rejection of the middle third of the face of this patient.
La cara de esta paciente. En este caso, por supuesto que no.
In this case, of course, they didn't try to make an orthodontic treatment, but they performed a surgery. That is a destruction of the whole middle third of the face. There was no other solution.
Otra solución. Puntos asfixiantes.
Through and through points through which the middle third of the face was pulled in posterior and anterior way.
La radiografía donde
The X-ray shows the treatment of destruction of the jaw.
ustedes pueden ver un resultado bastante favorable.
You can see a really satisfactory result. She was very happy. She was finishing her treatment. We made an exception of her treatment because our public health services don't have enough funds to finance it. You can see that the teeth show developmental defect. We tried to make implants, but the girl has not been found. As this girl, these patients end up with after effects, as you can see this 25-year-old young man. You can see the anatomic and functional after effects, breathing problems, chewing problems, hearing problems. Here you can see another patient. I could add a note. Socioeconomic and cultural reasons and long treatment don't allow you to perform integral treatments in public health services. Our public health services serve 80% of the population in our country. And now the obvious question. Can you prevent cleft lip palate? Yes, you can. There is scientific evidence that a significant number of cases of cleft lip and palate may be prevented.
Para terminar esta comunicación, quisiera decirles.
To finish this communication, I'd like to tell you that due to the lack of the community's knowledge on prevention, we have released this brochure related to prevention at the level of community.
Que dice relación con la prevención a nivel de la comunidad. Asimismo, quisiera hacer mención, esta campaña de prevención.
Also, I'd like to say that this prevention campaign is related to the Declaration on Children's Rights. Article 5 of the Declaration states that a physically and mentally disabled child that has a physical or social impediment should have special treatment, education and care required for his or her particular case.
En el libro, en el folleto, están contenidos las maneras de prevención de estas malformaciones.
The brochure contains the ways to prevent these congenital malformations that are basically based on the intake of folic acid and a multivitamin supplement. Women will find the basic principles of prevention.
En el folleto encontrarán los principios básicos de la prevención. Finalmente, quisiera enfatizar las principales.
Finally, I'd like to emphasize the main conditions to prevent these malformations. First, ensure that mothers are healthy. Ensure that fathers have a healthy lifestyle. Ensure that mothers have an appropriate nutrition by the intake of folic acid. Ideally, ensure to plan pregnancy, and also that there is a prevention campaign, a genetic screening.
Una evaluación genética.
Thank you very much.